All right, so get this ready for today. We are going deep, a deep dive into supplements and vitamins for peripheral neuropathy,
We are.
nerve health.
Yes.
And we have gone through tons and tons of research, over 36 peer-reviewed studies, and like a zillion articles, blogs, expert
Right.
interviews.
A lot of information out there.
Yeah, but before we get started, super important disclaimer, this is not medical advice.
Please.
We're just sharing information. Always do your own research and talk to your doctor before trying anything new.
Couldn't agree more. Your health is your health.
It is. So for anyone who's new to this whole thing, peripheral neuropathy, it often comes from nerve damage, and that can lead to things like pain, numbness, tingling, even weakness, especially in your hands and feet.
Yeah, it's not fun.
Not fun at all. But here's where things get really interesting.
Okay.
There's a bunch of supplements out there that might actually help.
There are.
And we've focused on the ones that have some actual science behind them.
Research backed.
Exactly.
Yeah. And you know what's cool is that a lot of these supplements, they actually go after the root causes of neuropathy. So that's like oxidative stress,
Okay.
which is damage from free radicals. And then you've got inflammation.
Those tiny little troublemakers.
Yeah, you are.
So let's start with kind of the VIPs of nerve health,
Okay.
B vitamins.
Yes. Love them.
They're super important for your nerve function,
They are.
repair, even pain management. So first up, B1. It comes in two forms, thiamine and benfotiamine.
Right. Thiamine is great, but benfotiamine really is the one that shines when it comes to neuropathy, particularly if it's related to diabetes.
Interesting.
Yeah, it's better absorbed by the nerves, and research suggests it can really help improve that nerve conduction and reduce pain.
So it's like thiamine, but like supercharged.
Exactly, a supercharged version.
I like that. So what about dosage, though?
All right, so for thiamine, you're looking at 25 to 100 milligrams daily if you have a mild deficiency, and then 100 milligrams 2 to 3 times a day if it's more severe. And then for benfotiamine, usually it's between 300 to 900 milligrams daily. Now, both of them, they can cause a little bit of stomach upset, especially at those higher doses.
Okay, so, something to be aware of.
Yeah, keep that in mind.
So let's move on to B6. Now, this one's interesting because both a deficiency and too much B6 can actually cause neuropathy.
Yeah, it's all about finding that right balance with B6. You don't want too little and you don't want too much.
Walking a tightrope.
So the maximum recommended daily dose for adults is 100 milligrams. But you know what's interesting? Neuropathy can actually happen even at doses below 50 milligrams.
Really?
Yeah, so that's why it's so important to work with your doctor to find that sweet spot. No,
I feel like we need to keep saying that because it's so important.
it is.
All right, B12, we've got to talk about B12. It's often called like the myelin hero.
Yes.
It's super important for repairing that protective coating around our nerves, the myelin sheath.
It is.
And when your B12 levels drop, that's when neuropathy can really start to become a problem.
Exactly. So you want to make sure you're getting enough.
So how much should people be taking?
All right, so for general nerve health, it's about 1,000 to 5,000 micrograms daily of the active forms. So that's methylcobalamin and adenosylcobalamin for about a month.
All right.
Now, if you have a severe deficiency, it gets a little bit more complicated. So it's the 1,000 micrograms daily for 5 days, then weekly for 5 weeks, and then 100 to 1,000 micrograms monthly for life.
Wow, that is a lot.
It is, but B12 is generally safe, but those active forms, they might not be the best if you have like severe anxiety. So always good to check with your doctor.
Absolutely. Okay, so we've covered the B vitamins.
Yes.
They're obviously super important.
They are essential.
But are there any other antioxidants that played a role in nerve health?
Oh, for sure. One that really stands out is alpha-lipoic acid, or ALA for short.
Okay, I've heard of that.
Yeah, it's a powerhouse antioxidant, and it helps protect those nerves from damage.
Okay.
But what's really cool is that ALA also seems to improve nerve blood flow, and it helps out other antioxidants like vitamin C and E.
Oh, so it's like a team player.
Exactly. It's not just fighting those free radicals solo, it's boosting other antioxidants too.
Okay, I like it. So what would you say is like the ideal dosage for ALA?
Research shows that about 600 milligrams daily seems to be that sweet spot, and it's usually pretty well tolerated, but some people might get some mild side effects like insomnia, fatigue, diarrhea, or a skin rash.
Okay, so nothing too serious, but worth knowing.
Exactly, just something to keep in mind.
Okay, noted. So we've talked about ALA. Are there other supplements out there that people should know about?
There are quite a few, but let's start with vitamin D,
Okay.
because that's been linked to diabetic neuropathy, and some studies have looked at 50,000 IU weekly for 12 weeks, or a single 600,000 IU intramuscular dose.
Wow.
It's a lot, but we need more research to really figure out the best approach for supplementing vitamin D.
Gotcha. What about vitamin E?
Vitamin E, so that might help prevent neuropathy that's related to a deficiency. The recommended daily intake for adults is 15 milligrams. But here's the thing, high doses can actually increase your risk of bleeding, especially if you're on blood thinners, so you want to be careful with that one.
Okay, noted. And then there's magnesium.
Magnesium. Oh, yes. Magnesium is like the unsung hero, often overlooked, but so important for nerve function and even pain relief.
It is so. How much magnesium should people be taking?
It really depends on your age and your gender, so it's worth checking out a reliable chart, but just be aware that high doses can cause some digestive issues.
Right, so finding that sweet spot is key as always.
Absolutely.
And what about curcumin?
Curcumin, oh yes, the amazing compound in turmeric. It's got those powerful anti-inflammatory and pain-relieving properties.
Right, so how much curcumin are we talking about here?
Well, studies usually use like 500 to 2,000 milligrams of turmeric extracted daily, but a good place to start might just be a teaspoon of turmeric powder mixed with some water or milk. But, you want to be mindful of potential GI issues at high doses, and if you're on blood thinners or if you're watching your blood sugar, definitely talk to your doctor before adding curcumin to your routine.
Always good to check.
Always.
Okay, what about CoQ10?
CoQ10 is a fascinating one. Our bodies actually make it naturally, but the levels can go down as we age.
Oh, interesting.
Yeah, and it's involved in energy production within our cells, and research suggests it might help protect nerves from damage.
Cool.
Yeah, the usual recommendation is about 100 to 200 milligrams daily, and it's generally considered safe.
All right, so that's quite a lineup of supplements.
It is.
But before we go too far, I think it's important to remember that sometimes neuropathy actually comes from specific vitamin and mineral deficiencies.
Right.
So in those cases, you really want to target your supplementation.
Absolutely. So, for example, B vitamin deficiencies, especially B12, are common in people who don't eat animal products.
Oh, right.
And then we can't forget about potential deficiencies in B2, B6, and B9. All of those can contribute to nerve problems as well.
Wow. There's so much to think about here.
There is.
And I feel like we've only just scratched the surface.
There's still so much more to cover. And speaking of different types, let's kind of unpack those. Now you've got diabetic neuropathy, that's the most common one, often triggered by high blood sugar levels over a long period of time, and that can lead to nerve damage, especially in the legs and feet.
Right. And then there's inflammatory neuropathy, which, as you might guess, is caused by inflammation.
Yeah, inflammation is a big one.
It can come from infections or autoimmune processes where your body's own immune system is attacking the nerves.
Right, your body's attacking itself.
And then there's painful neuropathy, which,
Oh boy.
yeah,
This one's characterized by some pretty intense, persistent pain, all thanks to that nerve damage.
it can be really tough to live with.
It can really impact your quality of life.
Absolutely. And I think it's important to remember that neuropathy, it's not like a one-size-fits-all thing.
Oh no, definitely not.
It can show up in so many different ways, like sensory neuropathy, for example.
Right, sensory neuropathy that messes with the nerves that are responsible for, feeling sensations, touch, temperature, pain.
Right.
And that can lead to numbness, tingling, or even like super sensitivity to touch, which can make everyday things really difficult.
Yeah, it's like your senses are all out of whack.
Exactly.
And then you have motor neuropathy that affects the nerves that control movement.
Right, and that one can cause muscle weakness, cramps, even problems with coordination and balance.
Like you're just not as steady on your feet.
Yeah.
And we can't forget about autonomic neuropathy.
Oh, autonomic neuropathy. That one affects those nerves that manage all those like automatic bodily functions.
Yeah.
The things we usually don't even think about: digestion, bladder function, blood pressure, even heart rate.
It's like a whole network of nerves just working behind the scenes.
Exactly, keeping everything running smoothly.
And when those nerves aren't working properly, it can really throw things off.
It can disrupt so many vital processes.
So we've got these different types of neuropathy, each with its own unique set of symptoms. But then there are also more specific forms too, right? Like mononeuropathy.
Yeah, mononeuropathy, that's when it affects just one single nerve, usually because of an injury or repetitive stress, like carpal tunnel syndrome. That's a classic example.
Oh, right. That makes sense.
Yeah, it's a very specific type.
So what about when multiple nerves are involved?
That's when you get multiple mononeuropathy. So that affects two or more nerves in different areas of the body. And the symptoms can vary a lot depending on which nerves are being affected.
Right. So it can be kind of all over the place.
Yeah, it can present in many different ways.
And then there's polyneuropathy, which I feel like is the one we hear about the most.
Polyneuropathy, that's kind of like the widespread version. It's affecting many or even most of the nerves.
Right.
And it usually starts in the feet because, think about it, those are the longest nerves in our body. They
Yeah.
stretch all the way from the spinal cord down to our toes.
Right.
So those are the ones that are usually affected first, and then it gradually moves upwards and might eventually reach the
It's
hands.
like it's slowly creeping up.
Yeah, it can be a gradual process.
So many different types. It's crazy to think about how complex our nervous system really is.
It is truly amazing.
But even though we've kind of laid out this whole map of neuropathy, we also have to admit that the research on these supplements isn't always so clear-cut.
Right. A lot of the evidence we have now comes from preclinical animal models, case studies, and small randomized controlled trials. So while it's promising, we really need those larger, more robust studies to figure out how effective these supplements really are for neuropathy in humans.
So more research is needed.
Always more research.
But I guess the big question is, what does all this mean for our listeners?
Yeah, what's the takeaway message here?
Right, what should people actually do with this information?
Well, the bottom line is that vitamins and supplements, they have a lot of potential to help with peripheral neuropathy, but it's not a one-size-fits-all solution. You need to be proactive. Do your research, understand the potential benefits and the risks, and most importantly, talk to your doctor.
Right, they can help you figure out which supplements, if any, are right for you and for your specific type of neuropathy.
It's about creating that personalized plan that takes into account your overall health, any medications you're taking, and your individual needs.
It's like each person has their own puzzle to solve.
Exactly, and your doctor can help you find the right pieces.
It really sounds like that open communication with your doctor is so important. But I'm curious, with all these supplements and all these different types of neuropathy, what are researchers most excited about right now?
Well, one area that's really interesting is combination therapies. Researchers are looking into whether combining certain supplements could actually work better together and create a more powerful effect.
That makes a lot of sense. Instead of just taking B12 by itself, maybe combining it with ALA or curcumin could really boost the benefits.
Exactly. It's all about finding those synergies. And there's also a lot of interest in personalized medicine. So, tailoring supplement recommendations to an individual's genes, lifestyle, and type of neuropathy.
So moving away from that one-size-fits-all approach to something more personalized and targeted.
Exactly. Finding what works best for each individual.
I love that. But speaking of individuality, I think it's so important to emphasize that everyone's experience with neuropathy is different.
Absolutely. What works for one person might not work for another.
So there's no magic bullet. It's about empowering yourself with knowledge, working with your healthcare team, and figuring out what works best for you.
It's a journey.
It is. And that's what we're all about here on the Deep Dive, giving you the information you need to make informed decisions about your health.
Knowledge is power.
It really is. So to wrap things up, we've explored a whole bunch of vitamins and supplements that might be helpful for peripheral neuropathy, from the B vitamins to powerful antioxidants like ALA and curcumin. We've seen that there are options out there that could offer some relief and support nerve health.
But remember, this is just the beginning. We encourage you to do your own research. Dig a little deeper into any supplement that caught your attention. Talk to your healthcare provider and see if it's a good fit for you.
And here's a final thought to leave you with. Could lifestyle changes, like gentle exercise, managing stress, and eating a balanced diet, make those supplements even more effective?
That's a great question, and it highlights how important it is to think about nerve health holistically. Supplements can be a valuable tool, but they work best as part of a bigger picture.
So keep learning, keep asking those questions, and keep searching for the knowledge that empowers you on your health journey.
Until next time, stay informed and stay well.